that this House has taken judicial notice.
Senator Sifuna, you were to clarify. I asked you to clarify.
Madam Speaker, you know, Senator Sifuna is a practitioner of law. Kenya is not a private company, it's not a shareholding company. Is it in order, Madam Speaker? Those ones you can say in public rallies and funerals. Madam Speaker, this is a house of records, and the President himself had said, even if it is judicial notice in Siaya, that each and every Kenyan will be served by government regardless of how they voted. Is it in order for Senator Sifuna to bring statements that are made in baby showers and funerals to the floor of the House?
Senator Sifuna.
Madam Speaker, I don't know what about me looks like somebody who attends baby showers, but let me say this, you're wasting my time. Madam Speaker, the most critical concern I have, and I hope my time has been posed under Section 31. Madam Speaker, if you read the language of the benefits under Section 31 and 32, it appears that there's going to be different categories of packages that people are entitled to based on the premium they are paying. Now, the problem that I have, number one, this Act does not disclose to us what tariffs are going to be applied to Kenyans in this particular new health scheme. We have not been told if it is going to be 2,000 shillings or 3,000 shillings, as opposed to the current situation where we know everybody pays the same amount of money. There is no clarity here, and it is being left to the Cabinet Secretary to set that tariff. And the Act says that every beneficiary shall be entitled to an essential healthcare benefits package. That is like what everybody is going to be entitled to. Is supposed to be a base package. We have not been told about the other packages. It's going to be a premium package for dynasties, and I'm sure this essential healthcare benefits package is for the hustlers. So let them be more clear, Madam Speaker, about the benefits. We don't want to be sold hope, and then we are told, no, your contribution only entitles you to this, what are called essential healthcare benefits. If you want anything else, you have to add money. We want that clarity in the packages, and we want the clarity in the contributions. It cannot be left to the whims of the Cabinet Secretary. Madam Speaker, I want to finish by saying that I am very happy with one provision here on the establishment of an emergency fund. As SG of ODM, as a member of Azimio, we did promise that we were going to implement, if we got government, the provision in the Constitution that entitles everybody to emergency health care. We have seen cases of people dying in ambulances here in Nairobi because the hospital that you've been taken to will not admit you until they know who's going to pay for that admission, Madam Speaker. So this is something that I would support, the Emergency Chronic and Critical Illness Fund, and this money is going to be able to go to guarantee that the cost of emergency treatment, if you find yourself in an accident somewhere, maybe people don't even recognize you. You might have your premium insurance, private insurance, but people do not recognize you, or you are driving alone, you are unable to retrieve your card. They should be guaranteed that every person who's taken to any hospital in the country under emergency circumstances will receive.
Senator Abbas Sheikh Mohammed.
Honorable Speaker, thank you for giving the opportunity. Honorable Speaker, I think the social health insurance is actually an appropriate insurance for Kenyans for health cover. And this replaces actually the old NHIF. As you're aware, in the past, NHIF actually has been giving health covers to this country, but there has been a lot of abuse in provision of services, payments, and there was a lot of cartels involved in these things. Having said that, the current social health services, hopefully, as it is said in the bill, will have a lot of check and balances to minimize any abuses of the service of the health insurance. Honorable Speaker, actually, primary health care is a very important facility for Kenyans. Actually, most of the Kenyans cannot afford to pay for the premiums that are given by the social, by insurances, especially the private insurances. And the Kenyans, I think, the social health insurance now becomes a safety measure for the Kenyans, so that at least they can be able to access appropriate health services. However, there are two concerns. One is actually, as said by Senator Sifuna,